I'd like to talk about how to take the collar on and off. This is a very common question that we get as well. I'm currently wearing the Aspen collar. The one thing I want you to notice is the front part of this collar that makes the collar either taller or shorter. This particular collar has a device that if it's rotated clockwise, it gets taller. And then if it rotates counterclockwise, it gets shorter. That helps me to open up my jaw. So the easiest thing to do is to first lower it. The second is then taking the Velcro just off of one side and remove. At this point, I can then do my wound care or change my dressing as needed, or if I'm a few weeks out, I just want to wash the neck or get in and out of the shower. Very importantly, when you go to put the collar on, the most important factor is getting this underneath your chin. If the collar fits underneath the chin and is tucked first, then you can wrap this around and it is now supportive of my neck. If I don't do that, and I just try to put the back of the collar on first, and then bring the front collar in, the back of the collar will keep this from going underneath my chin, and now it's not immobilizing my spine the way it needs to be. So the very most important thing whenever the collar is taken on and off, the first thing is just take your hand and bring it up so that it supports underneath your chin. The next question that we get is, well, how tight does it need to be? And the job of this collar is mostly limiting up and down, as well as a degree of lateral movement. So when I'm eating, I need to have this shorter so that I can get probably 2 finger breaths in there. That way I can open my jaw to be able to eat. When eating is over, then I want to raise the collar, again turning it clockwise, until I can just get 1 finger in there. If I can get 1 finger in up and down, it's not too tight, but it's supportive and holding me where I need to be. If I try to say, okay, well, if a little bit tight is good, tighter's got to be better, that doesn't always work. Because if I go up even tighter, now I have to turn my head backward, and it's very hard for me to open my jaw, and it tends to hurt my TMJ. So we want to keep a little bit of that sag in the collar, so we want to be able to get 1 finger breath in as kind of a normal fit. A very common question in regards to utilizing the cervical collars is, when can I drive, and can I drive with a hard collar? And the answer to that is no. The hard collar restricts mobility too much to be able to safely drive. So what we do for patients is to be able to remove the hard collar for driving and utilize a soft collar for the trip. That way I can turn and be able to move and be able to see what I need to be able to see to drive safely. Then when I get to where I'm going, I will remove this and then put my hard collar back on. An additional question regarding the collars is, do I need to sleep in the collar? My general recommendation is yes, early on. The reason for that is during our sleep cycle, there are parts of our sleep cycle where our head actually rotates forward and we kind of ball up. Oftentimes the neck, the freshly operated neck, isn't quite ready for that. So the collar limits the excursion of the spine during that particular part of the sleep cycle. That allows people to wake up without having more neck pain. Many patients want to know how long they need to utilize it at night. My general recommendation is for at least the first 2 to 3 weeks to utilize the hard collar at night. Then they can try going to a soft collar and seeing if that is enough immobilization during your sleep cycle, so that when you wake up in the morning, that the neck doesn't hurt.